Hi everyone, this is James Ritchie of the Anti-Aging and Wellness Group. We have clinics in Louisville, Kentucky, Tampa, Florida, San Jose, Costa Rica, Mexico, and Panama. Today we're going to talk about Phentermine for medical weight loss. Phentermine has shown in research that in combination with lifestyle modification, it can be a very effective drug for medical weight loss. We do use it in certain situations. And with the obesity epidemic that we have right now, it can be a great go-to tool along with medically supervised weight loss protocols and lifestyle modification to help you out with your weight loss. If you've had difficulty in the past with HCG and other methods, you might want to look into this. Essentially, the way the program works is that once you inquire, we set up a consultation. You have a consultation with the physician. You'll discuss your medical history. We're going to do a biochemical assessment. That's going to be a blood test where we look at key markers for your overall health and wellness. The doctor will do an EKG just to check your heart function. We may use other prescriptions as well. Sometimes doctors will use a combination of prescriptions as long as they're not contraindicated with this medication. We'll do a body composition assessment, and then we'll build in the total age metrics program. And the age metrics program consists of lifestyle modification based on a set of parameters that through much of our research that we've done have been able to isolate these parameters, and they're used as kind of like decision support for your physician and your counselors to help guide you through this program. And we know by looking at these parameters, we're going to give you the best chance of getting results. Okay, so let's look at, first of all, keys to diseases and health and obesity. Really, we have probably the leading problem with obesity is our diet. We eat way too many processed foods. But in addition to that, we're exposed to environmental toxins, and these toxins can be endocrine disruptors, and they can affect our hormones and our body's metabolism and slow it down. And then if we're not getting enough exercise because we just don't have the motivation or the energy to do it, all of these factors play a big role with that. So in this whole program, we're going to try to teach you to eat the right foods so that it's not a calorie restriction program. You know, an HCG diet or some of these other diets are calorie restrictive programs. And what that means is, you know, you're going to feel like you're starving all the time. You're not going to get that with this program, okay? So let's just look at the obesity epidemic right now in this country. Right now, we have an obesity epidemic that shows that about 70% of our population is either overweight or obese. And what these do is they lead to chronic disease. So right here we see men, we see women, we see the total, we see men, we see women that's overweight or obese. We've got 70% here. Women maybe a little bit, or men maybe a little bit worse in this category than women. But as we get into the severe obesity or extreme obesity, women actually are a little bit worse than men, okay? So that's not something that we want to see. And what this program is going to do is it's going to help you change so that you can avoid some of these chronic diseases. If we look at chronic disease, right now we have heart disease as our leading killer, and there's 614,000 people that die just about every year, maybe even more than that in some cases. With cancers, which is the purple line, there's 591,000. These are the two leading causes of death. They're way off the charts, and most of them are lifestyle diseases. So contact us today. We'll get you on a program, and we'll see what we can do for you to get you to lose weight. Even if you've had trouble before, this is what you want to try. You want to try a diet program with us, okay? Contact us today. Thanks.